Hello, I am Dr. Sagar Jawale. I am a stem cell therapy expert and I am practicing stem cell therapy for a variety of diseases from last 7 years in my Jawale Stem Cell Therapy Center in Jalgaon, Maharashtra. I have received 5 degrees from prestigious medical colleges in Mumbai such as KM Hospital and Sion Hospital. Last 23 years I have been practicing in Jalgaon. Out of which 7 years I have been doing stem cell therapy for various diseases. In this particular video, we will discuss stem cell therapy for cerebral palsy. Please subscribe to this channel by pressing the bell icon button below and like this particular video so that whenever I make a new video, it will reach you effortlessly. As I said that we will discuss about cerebral palsy and stem cell therapy in this video. Let us see what is cerebral palsy in short. Cerebral palsy is the neurological condition of children where at a very tender age, since birth or in infancy itself, the child has a trauma or injury to the brain, and that's why a particular part of the brain dies and there are subsequent consequences to the rest of the body. What are the causes? Causes are generally hypoxic brain injury during delivery. So at the time of the birth of the child does not cry or due to a variety of reasons. The brain is not oxygenated, so the particular part of the brain dies. Another causes could be viral infections in early childhood or vascular accidents, incidents or trauma, and some cases the causes may not be known also. And what are the symptoms? The children, they have a spasticity of the limbs like this. It could be all 4 limbs or 3 or 2 limbs or single limb also. There is a problem in speaking, problem in deglutition, means swallowing. There could be problem in hearing and as well as seeing things. There is a problem in cognition with low intelligence and mental retardation. Some patients have attention deficit hyperactivity disorder, ADHD, means they are not able to concentrate on a particular task, and some patients may have learning disorders. Some patients may have convulsions. There is a severe growth retardation and it's a developmental disorder of childhood. The conventional treatment is physiotherapy, behavioral therapy and all sorts of therapies with some limited results because they don't really solve the problem in the brain. The problem is that a particular part of the brain is damaged. That's why its inhibitory control on the centers in the spinal cord is gone and the lower motor neuron goes hyperreflexive or hyperactive. So the upper motor neuron is weak and the lower motor neuron is hyperactive. That's what we speak in medical language. So in this stem cell therapy, what we do is you have to stay for 5 days in my center in Jalgaon, Maharashtra. First day we do all your investigations with your MRI scans and your fitness. The second day the child is given general anesthesia and the bone marrow is retrieved from the iliac crest near the backbone, and the bone marrow is processed and stem cells are relieved and purified from the bone marrow. When the child comes out of anesthesia, then the cells are given intravenously into the blood through a peripheral vein, and then 2 days of observation and then you are sent home. So this is how the therapy is designed, and in this particular therapy the side effects were not noted. Side effects were minor, such as some bleeding or some pain, maybe some skin rash, but no serious side effects were noted. And the cost of the therapy is also we have reduced significantly. It is only 1/3 compared to other centers. So the therapy is safe as well as affordable. Now we will see that how the stem cells work in case of cerebral palsy. So the stem cells, when you put in the blood, they duplicate. Duplication time is only 3 days, and they survive up to 3 to 6 months inside your tissues, and during that time they release 50 types of growth factors and cytokines. The stem cells are large in size, so usually they don't cross the blood-brain barrier, so they don't go into the brain. But the growth factors and cytokines released by the stem cells are tiny little molecules, and they do cross the blood-brain barrier, and they certainly go to the brain, and they make positive changes and regenerative changes inside the brain. And that is how the therapy works. In some of the centers, the stem cells are given into the cerebrospinal fluid into the back as in the form of injections, but it can be dangerous. That's why in our center we restrict to just giving into the blood, because there are many trials where the cord blood has been given or patient's own stem cells have been given intravenously, and the results are comparable to the intrathecal injections where the cells are injected into the spinal cord. So the results are the same, and the side effects are serious side effects are not noted in by giving in the blood, so it is safe. Whereas the intrathecal route, putting directly inside the brain, can be dangerous and can lead to problems. That's why it is not given in our center. Now we'll talk about the results, that what are the results. So I did more than 50 cases in last 7 years, and out of that some 26 cases data has been published in international journal, which is indexed, and the publication you can see in the description box. So in this particular study, what we observed is that we got extremely good results in most of the patients, and certain things we reported for the first time in the medical literature, such as almost out of 22, 18 patients had squint, so defect in the eye, and without touching the eye the squint was corrected in 18 out of 22 patients. It's almost a modern day miracle. It is also a living proof that the cells, or rather the growth factors released by the cells, has reached the brain, because the nucleus that controls the eyes is seated deep inside the brain, and so the growth factors have reached that area. That's why such a thing could be done. So this is reported for the first time in medical literature by me, a complete series of it. Then I also reported around 6 patients who had a problem in swallowing. When they eat, they had only 10% food is to go inside the mouth, 90% is to drool out, and that's why they have malnourishment and they get very weak, and sometimes they die also because of that. So in 80 to 90% of the patients, this problem was also corrected. The children could eat, and 80 to 90% food can enter inside the food pipe now, and only 10% drooling was seen. So this is again reported for the first time in the medical literature. Some 3-4 of my patients had a significantly improved hearing, who had hearing loss due to cerebral palsy, and few patients had improved vision. The vision was poor or blurred, and that dramatically improved. Some patients had improved intelligence. The child dramatically progressed on milestones, started concentrating, started giving intelligent looks, social smile came, and the milestones which were delayed got corrected to a very large extent. So this is a revolutionary and a very dramatic improvement that comes in these patients due to stem cell therapy. Then the spasticity, which was in the upper extremity or lower extremity, the tightness, you can say, that was drastically reduced because the upper motor neuron improved and its inhibitory control came under lower motor neuron, and the spasticity was dramatically improved. And that is why out of 18 patients, some 6 patients were not able to walk properly, and 3 of them started walking within 6 months of the therapy. It's a great achievement that the child was paralyzed due to spasticity. Since the spasticity was reduced or gone in some cases, the child could now start walking. One child I did was 8 years old, so at 8 years he could not walk even a single day. Children start walking in 1 to 1.5 years. After 8 years, he started walking just within 3 months of the therapy. So we had such miraculous results also. So most of the patients had results, and some had dramatic results, some did not have that dramatic, but everybody got some kind of results after the therapy. Another beauty of the therapy is that it can be repeated any number of times, because bone marrow is a replaceable modality. Your body replaces whatever bone marrow you have taken out is replaced within 1 month, maximum 3 months. So after 1 year or 6 months, you can easily repeat the therapy any number of times, but generally these patients will require 1 session or 3 sessions maximum, 1, 2 or 3 sessions, not some 50 sessions or something. So the 1 to 3 sessions are affordable also, very safe, and most of the patients will have 50 to 75% improvement after 3 sessions. So you can see that a kind of drastic improvement these patients have due to stem cell therapy. And in the description box you can see my publications where I have quoted all these things in detail, and it is accepted in the scientific journal. The best results are obtained till 8 years of age, because till 8 years of age the brain is growing. But our advice is to do it as early as possible. So my advice is to get it done around 1 year of age. So the smallest I have done is 9 months. Smallest child I have done is 9 months. But around 1 year of age, it is the best time to do. Up to 8 years of age, the results are good. After that also therapy can be done, but the results are not that good. But there are many patients who say we missed it, so at least child will get some results, we are happy with that, so we can do with that understanding. But we recommend only till 8 years of age, and the best age is around 1 year. So that is about the timing of the therapy. So I think we have fairly discussed the whole thing in details. Under the video, in my description box, you will find my website, my contact number, my mobile number, WhatsApp number, email address, and the publication. You can contact me and take appointment and get benefited. Thank you very much.